So, Darlene, what's your take on using AI in healthcare?
I think AI offers us tremendous opportunity for advancements in healthcare, but I think we also have to be very careful about how we use it. And we've got to not make the kinds of mistakes we've made in the past when we bring new things into healthcare. We tend to get excited about the possibilities and then we don't build them. We don't implement those things in ways that actually benefit us.
Hello, and welcome to this podcast titled Saving Healthcare, where we talk about the issues plaguing the healthcare industry. My name is Nicole Travis, and I'm here with Darlene Bainbridge. Darlene has nearly 50 years of experience in the healthcare industry, ranging from a frontline caregiver, a quality director, a risk consultant, a CEO, and a board chair. Today, I'd like to spend some time talking about AI in healthcare. This is a topic that we're hearing a lot about lately. We see AI being referenced in software and in education and in different areas of the healthcare industry. And I think it's important to talk about it from the perspective of AI with risk management and how that can impact the healthcare that patients receive. So, Darlene, what's your take on using AI in healthcare?
I think AI offers us tremendous opportunity for advancements in healthcare, but I think we also have to be very careful about how we use it. And we've got to not make the kinds of mistakes we've made in the past when we bring new things into healthcare. We tend to get excited about the possibilities and then we don't build those things. So we don't implement those things in ways that actually benefit us. Probably one of the best examples of that is the mess we now have with EHRs. They were a promise to the healthcare industry and the American people that we were going to create this breakthrough performance that would make patient care more efficient, more effective. We'd have less errors. It would be easier for our staff to spend more time with their patients. And none of those things have happened. But they haven't happened because we didn't build those tools to make them happen. And so the question is, now what are we gonna do with AI? Are we gonna make the exact same mistakes we made with electronic health records? Or are we going to sit down and figure out how to use AI to take our industry to a better place? It's like I spoke at a conference last week on the how quality and risk management is the role it's gonna play in helping us to save healthcare. And so part of that whole conversation, because of some other speakers that were there, was the topic of AI. And so I said to the group, I said, "So how many of you have identified the risks that come with AI and set your risk management programs up to identify those risks and be on top of them before they can get out of control?" And this was an audience of probably about 100 people from different healthcare organizations. Not one person raised their hand. Not one hospital sitting there said, "Yep, we figured out that we know what the most important risks are and we are on top of it. So our staff knows to report them when they play out. And so we can figure out how to incorporate AI into our organizations in a way that doesn't create problems for us, doesn't create another category of malpractice claims for us to deal with." And so I'm very excited about AI, but I am terrified of AI because I don't think we're going to implement it with any smarter, forward thinking activities than we've implemented everything else that now is a strain on our industry. A good example of that is we're starting to see in the industry something that I call management regulations. All right. So we aren't in good control of something that has the potential to hurt the patients or somehow create a problem in the healthcare industry. So our model for the last 50 years is the government issues a regulation that says, and you will. You will do this. And then we don't figure out how to do it in a big enough and impactful enough way to actually make a difference, to be in control of whatever the issue is. So they start issuing what I call management regulations. Then these next set of regulations that come out are the how to regulations, how you will do it. You will fill out this form. You will do this. You will do that. And because our measure of success in healthcare is compliance, not outcomes, it just creates this mess for the healthcare industry. So we're already starting to see what I call management regulations in healthcare. We're starting to see regulations that say if you use AI to create progress notes or generate some sort of patient care note, that patient care note has to reflect the fact that it's a computer generated note, not a physician generated note. And so we're already starting to see the regulations, those types of regulations manifest in healthcare because we're also starting to hear the ugly stories about how we use AI and then there's something negative that happens. It's like when you go into a doctor's office now or a clinic office, I was just in an urgent care center the other night. They walk in, they have this little box that looks kind of like a cell phone. It's about the size of a cell phone. They lay it down on the counter and they say, "This is a device to help us create our notes. And so I have your permission to use it." And of course you say yes. And so it's an AI tool. So it records the whole conversation between the physician and the patient, and then AI generates the physician progress note. And just like with old times transcription, the physicians are supposed to read the notes and approve them before they get used in patient care, which in the chaos of the present environment, I'm not sure how often it doesn't happen, but I'm guessing is fairly significant, or we wouldn't be hearing stories about how these notes are just then driving some negative patient thing to play out because something in the note was not accurate. There was some problem in the note. And so we've taken the old school transcription problems we had where physicians would dictate their notes. Some person would sit there and transcribe them, but then the physicians were supposed to read them, correct them, and sign off on them. Now we're using AI to do that because there's benefits in doing that. But the question is, when AI can now generate an even longer progress note than the old transcription methods did, what's happening with those notes to make them accurate? We have a radiology crisis in healthcare right now. So we're starting to use AI to help us read x-rays. So where is the mechanism in our hospitals if we have something that's missed on an x-ray and it was AI read, it throws up an incident report or some sort of a flag that says we need to evaluate this. We need to figure out how this isn't going to happen again in our building. And because of the way our quality and risk management models have historically operated in a reactionary type model instead of a proactive model, more than likely what's going to happen is those things will only appear as things that have to be identified in a lot of our hospitals once there's enough ugly stories to prompt some outside entity to force us to address them. We have
Yeah.
to get out in front of this stuff instead of running to catch up with it. It's like at that conference I spoke at. I said to the group, I said, "So how many people in this room feel that your EHRs have actually made things better in your hospitals? It's easier for your staff to spend quality time with your patients. It's easier to access information you need to make good decisions about patient care. All the things that EHRs were supposed to do for us." And again, not one person in the room raised their hand. But see, if we don't get AI right, we're gonna go down the same road we went with EHRs. It cost us a lot of money to build EHRs. And they weren't because they weren't designed to give us what we needed, but it would be too costly to actually fix them or rebuild a new EHR. We now just keep layering stuff on top of the problems that existed in the original EHRs. Well, a lot of times what we're doing is in the concept of progress, making things better, we're actually making things worse. We're making it even harder for our staff to use those tools. So at some point in time as an industry, we've got to step back and say, we're not going to do this anymore. And AI is a great place for us to start. We're kind of in the infancy stages of using AI in healthcare. So let's just get it right the first time. It's like I'm terrified of these conversations that are being had right now. We're going to shorten the length of time physicians have to go to school for training because AI will support them. They can use AI to figure out how to treat their patients. We aren't far enough along in understanding AI and how to really use AI well, I think, to be making that kind of a decision. I was just at a meeting where we were talking about some states are now talking about shortening the amount of time their nurses have to go to school because of the nursing crisis. It's because AI will be there to back them up, help them make patient care decisions, help them figure out what they got to document. I mean, AI is not advanced enough in the controls it can exercise in order to be able to do that. So, from a risk management perspective, every risk manager in healthcare should feel tremendous job security right now because we're going to have more incidences, probably, not less, unless we get smart about how we bring AI in healthcare.
This reminds me of the airline industry in a way because a as technology evolved, the training changed to some extent because you could rely on the technology that the planes had, and it wasn't so manual to fly the planes, and then as some accidents happened, it was decided that you needed to go back to the basics with training and make sure that the planes could be flown without the technology. And I feel like we're gonna run into that with this. You can't be dependent on AI. You can't not know things because you're gonna rely on AI to give you those answers. And that is kinda scary to think about.
It is, but the airline industry is a great example because there was a period of time where the airline industry thought, we'll just set it up so the planes can fly themselves." Well, yep, and they can for the most part, but the fact of the matter is there are certain functions that require the intellect of a person and the reaction time of a person to protect all the passengers that are on the plane. And if the technology fails, the crew in the plane have to know how to fly that plane and what to do to safely get it on the ground. You can't take technology and just plop it in someplace and say, "Oh, and this is gonna solve all our problems." It's not. Technology, it's tools. It's tools to take human capacity and make that human capacity do more things in faster and better ways. But you can't take the human capacity out of it. It's like these AI generated progress notes. I read them all the time. And to be honest with you, there's things about them that I love because there's a level of detail in there that we've never had in our progress notes because the amount of time it would take to manually generate them. But now we have the risk that oddball things are going to make it in there, or things are going to be interpreted one way by the computer when that's not what was meant, but that's going to make it in the note. So if there's not somebody to catch that, so that it doesn't negatively impact patient care as we're using these notes as our communication tool between specialists. You know, you go see your primary care physician, he refers you to some specialist. The specialist sees you, and then that specialist says, "Oh, this isn't in my bailiwick." So he sends you or she sends you to another specialist. And then that person sees you and says, "Oh, this really requires the input of a surgeon." So that person sends you to a surgeon. And what's following you through all these appointments are those notes that say what every physician found, what their thoughts were, what their suggestions are for patient care. So if those are not accurate, I mean, really accurate, there is a good chance that some patient will get the care that's not right for them. And so but we're just plopping these systems in these buildings and not figuring out what the risks are, creating an easy way for the staff to be aware of the risks, for the staff to report the risks, for us to investigate the risks when they play out, and then for us to come up with better answers to how we're going to do that.
So I'm sure a lot of people that were involved in the building of EHRs would comment that 2020 hindsight is an amazing thing. If only we knew then what we know now, we would have built them differently. But what does this process look like to be able to say, this is what we need to do now to make sure AI is used in the right way and has the process in place to catch these problems?
I think that one of the most important things is we have to move to a more forward-thinking type of quality model and risk management model. We still like I've mentioned on other podcasts, healthcare's been stalled in what Westrom and Hudson would call a bureaucratic quality culture or risk management culture since around the turn of the new century. And we've just been stuck there. And the bureaucratic quality culture is a backwards thinking culture. It builds everything to address what yesterday's issues were. And it doesn't have any conversation about what tomorrow's issues could be. And so we build, so like the EHRs were built to solve a set of problems that were playing out at that very moment in time. And it was a very teeny tiny list of issues that you had to show you could address in order to quote, "have a successful EHR." Nobody was having any conversations about what the real issues were that we needed the EHRs to address. Like, you put a piece of information in the EHR here, and if it's needed in 6 other places, it automatically transfers there. I mean, there were so many things our EHRs could have done for us to improve productivity, make life better for our nurses and our doctors, reduce our risk of errors, and none of those things ended up being addressed in the EHRs because they were built to solve yesterday's problems with no conversation about what we needed them to be able to do for us going into the future. And we could have had those conversations. There were a lot of people out there having those conversations. But none of those things made it into the ultimate document or whatever defined what a good EHR was because of the bureaucratic quality culture that healthcare was operating in at the time. And so AI, we need to be building AI using what they call a generative quality and risk management model. We sit there and we proactively say, so what could go wrong if we use AI? You know, these are the benefits. So what are all the things that could go wrong if we use AI? We start figuring out how to use AI to not just control for yesterday's issues, but to be in control of what is we know could be happen tomorrow. All right. We've got to get away from this chicken and the egg conversation that takes place all the time in healthcare. It's like when I used to be a quality director of our hospital, And lasers first came into popularity in the operating room because they offered tremendous opportunity to advance surgery. But they also came with a lot of risks. We could have fires in the operating room if we didn't use them right. We could cut the wrong thing very much more easily with a laser than we did with a scalpel. And there were just a lot of risks that came with them. But we didn't really wanna talk about the risks because we were excited about using lasers in the operating room. And so I was reading this article one day, and it was talking about the risks that came with using, lasers in the operating room. And I thought, "Oh, this could ha I don't want this happening to any of our patients." So I went to my CEO, I was telling him about the article, I was telling him about, some of the things I think we might need to do different in the OR just to minimize the chance that any of those things could happen. And the conversation I had with him was classic of the kinds of conversations that frequently take place in healthcare. And he looked at me and he says, "So have any of those things happened to one of our patients?" And I said, "No." He says, "Are you positive one of those things could happen to our patients?" I said, "Well, the literature's suggesting the risk is there." And he says, "But if we don't know for sure that it would happen to our patients, why are we gonna change our processes to prevent something that might never happen?" And that's the chicken and the egg conversation. Which has to come first? Do we have to be aware of the risk first, so we proactively try to minimize the chance that it could happen? Or do we have to hurt a patient or kill a patient to know for sure that it could happen before we will attempt to address in a bureaucratic quality culture, because it's a reactive culture, we sit around and we wait for confirmation. In a generative culture, we sit there and we say, these risks could happen. They've happened in other buildings, or it's obvious they could happen. So we're going to get out in front of them and we are going to do the very best we can to prevent them. Because, Nicole, this is the part that drives me crazy is the fact that the changes that it would take to manage a lot of this stuff proactively are not expensive changes. They're not hard changes. Because it's generally a small and simple changes in the way we do things. So where the real cost comes is when we wait and then something negative happens, and then we've got oodles of costs that we have to deal with. We may have to deal with a medical malpractice claim. We have to deal with the regulators if they have to get involved. We have to d There's all these things that we have to deal with where the simple act of prevention would have prevented all those things. And so I just wanna like I said, I'm so excited because I think AI could do a lot of really good things for healthcare. But I'm equally as scared of it because I'm terrified we will not manage it in a way that we can prevent the negative things that could come with it.
Well, I think proactive is a huge thing with this. I mean, I know data collection is going to be a thing with tracking AI and how it works, but efficiently tracking data is going to be important. On time data, not retroactive to the point where that data is no good to us anymore. Like we see with a lot of data that's being collected now, and I know we're going to talk about that a little bit on our next podcast, but just being efficient and effective and proactive is gonna be huge, as we start to see AI play out in healthcare.
I agree. Start small with AI. We don't have to climb to the top of a 1,000-foot cliff and jump off and then try to go back there and clean up all those messes. Start small with AI. Get comfortable with AI. Try AI in an area where your risks are smaller if you just jumped off the cliff in another area of patient care. learn how to get comfortable with AI, and then just keep incrementally implementing it. It's kind of like for anybody who's ever read any of Jim Collins' work, he talks about this flywheel concept, which I think is gonna be huge for fixing what's broken in healthcare. But, he says you start with something, create success, and then you use that as the foundation to push the flywheel forward. And then you move on to something else. And then again, you turn the flywheel and you keep building progress. See, we've never done that in healthcare either. We just jump off the cliff and then wonder why the water wasn't deep enough when we hit the water to to be successful. And our problem in healthcare is we don't have enough money and manpower left for those kinds of leaps. We're losing staff right and left because of the way the environment presently operates. Our operating margins keep shrinking no matter how many new services we add. And so we've got to be smarter about how we do some of this stuff. Start small with AI and then build it.
And as you build and as you get comfortable, remember the comfortable is different than complacent. It's a tool to help you, but not to replace things completely.
Right. We gotta stop using compliance as our measurement of success. It's a process-oriented measure. So did we implement AI? Yes, we did. Are we dying because of AI? We could be because we're not measuring stuff in terms of outcomes. We're measuring stuff in terms of, so did we check that box? Did we do this? Did we do that? And we very rarely in healthcare have the corresponding conversation about outcomes. That's why a hospital, even today, can do extremely well on an accreditation survey and have something terrible happen to a patient within a very short period of time because we measure that success in terms of satisfying well, it's a huge number, it's still a relatively small number of process measures that surveys look at, and very often, we won't have any conversation at all about the outcomes they produce. So, we're short on outcomes, but we're huge on activity in healthcare. Our staff in healthcare is so overwhelmed with our activities now that I say to hospitals anymore, "If you're gonna add something for the staff to do, you better figure out what you're gonna take away." Because innately 2 things you're gonna take away, because you just can't keep dumping on the staff and expecting them to stay. And so I just want healthcare to step back from AI and start asking themselves, "So what are the outcomes we want to achieve with AI? What are the risks that we have to manage effectively to achieve those outcomes?" Because outcomes just don't magically appear. It's like all the promises we were handed with what we were going to be able to do with EHRs, none of those outcomes appear. And it wasn't because the concept was bad, it's because the implementation and creation was bad. But you can't just blame the vendors because who was telling them what we wanted? I had a conversation one day with an EHR vendor, because we were talking about a lot of the problems they're facing right now, trying to deal with the issues they have with their tool. And they said, "But we went to the hospitals. We actually went out to hospitals and then we said, 'What do you need in your EHR?' But here's one of the problems we have in healthcare. Because of the compliance culture we've operated in for so many years, a lot of our people don't think in a futuristic term. They think in terms of what they need for today to survive, to be in compliance." When we were having this conversation, I said to them, I said, but did you point blank say to them, if this EHR could do for you what you will need it to do for you 10 years from now, what would that be? And they said, well, no, we didn't ask those kinds of questions. We just asked them what they needed from an EHR. And I said, so you know what they gave you? Is the list of what they needed for to solve today's problem. I said, and so you built it. And now you have to live with it. And you have to figure out how to make it work better because it's not hitting the mark. But see, with AI, are we having the conversation that says, if AI did for us what we're going to want it and need it to do for us 10 years from now, then what does that look like? And then you have to be willing to listen to the people who have that futuristic type of thought process, because not everybody does. It's like I was talking to this one woman when AHRs were being built. She was hired by an EHR vendor to help them build an ideal tool, the best EHR. And she was one of these futuristic type people. She was thinking way out into the future. And she finally quit her job. And she said to me, she said, I quit because every idea I introduced, they shot down. They didn't want to build it. And she said, so now, she says, every one of those things I suggested is they needed because that's where their issues lie. Their issues lie in the fact that their tool can't do those things. And so the ultimate question is now AI is an opportunity for us now, for the first time in a very long time, to get this right. And the question is whether or not we will.
Well, it'll be interesting to see how those rolls out. There's so many different ways that AI can play into the healthcare industry. We've seen software companies now marketing, we use AI, and just understanding exactly what they're doing with that to make it work and how it's going to help them. On top of the patient care will be interesting to see. Do you have any suggestions for people as they start to use this in their own facility that you haven't mentioned already?
Well, the first, I have 3 suggestions, and I've already kind of mentioned them. 1, start small. Figure out what it really is, because, every person you ask, "What is AI?" they'll give you a different definition, all right? So, start small and grow from there. It doesn't hurt us to start small because in the long haul, it will prevent a lot of cleanup down the road that we can't afford anymore. And it'll prevent a lot of hardship on our employees, all right? Second of all, I would suggest that you really sit down internally and have a conversation about what you want from AI. How could AI help you? It's just having AI doesn't necessarily help you. It's only if it does something for you that takes you to a better place. It's kind of like for us. I'm frequently having the hospitals we work with say to me, so are you going to implement AI in SQSS? And my response to them is yes, as soon as I figure out how AI takes what SQSS does to a better place. I'm not going to just incorporate AI into SQSS to say I have it. It's interesting because we have a competitor who has started marketing their tool as, and we'd have AI. It's the one of the big marketing gimmicks right now. We have AI. And so one of our hospitals called me and said, "So are you going to implement AI?" And I said, "It when I have figured out exactly how AI will take our tool to a better place." And they said, "Well, this other vendor's got AI." And I said, "Why don't you go back to them and ask them exactly how they use AI to benefit the hospital?" I said, "Outcome. You want to know the outcome AI creates." Well, they called and they didn't get a real they didn't say he said, "Well, I didn't really get an answer." They kind of talked in circles, all right? Because see, AI is a marketing gimmick right now. We'll give you AI. Well, does it do anything for you? Well, AI is the outcome. See, that's the difference between a bureaucratic culture and a quality culture. The process of implementing AI is the outcome. It doesn't matter if it produces a net gain outcome because in a bureaucratic quality culture, the process is the outcome. And then the third thing I would suggest that you do is you sit down and as you implement AI, you figure out what your risks are. What are the risks you have to be concerned about? Identify them, get them into your incident reporting system, and encourage the staff to report. To report when there's a note that doesn't seem to be right based on what's going on with the patient. When we got an X-ray report where the interpretation isn't consistent with what other diagnostic evaluation suggests is wrong with this patient. But we've got to start identifying those risks early, evaluating them, and then figuring out how to make AI a better tool for us because it's only a matter of time now, I think, based on my years of experience doing risk management and having worked in a medical malpractice insurance company, that we're going to start seeing malpractice claims that are AI related because of a misdiagnosis or a miss this or a miss that. Something's going to come out, and then all of a sudden we're going to start seeing malpractice claims. I would like to think, as an industry, we are going to implement AI so well that we can minimize the number of ugly stories and the number of malpractice claims that we have in healthcare because of the implementation process. Because a lot of those one of the things I learned reviewing cases when I worked for the malpractice claim company is that a lot of them could have been prevented if the processes inside the hospitals had just been a little bit stronger. And so we have to now make that move in healthcare.
I agree with you. And it'll be interesting to see as we go along. So, just in an effort to wrap up today, do you have anything else that you want to point out on AI?
I don't think so. I just would strongly encourage the hospitals to do those 3 things. Start small, really understand how it's gonna benefit you before you just implement it. And then, figure out what your risks are and make sure that you're identifying them. There's a whole host, just entering into a contract for AI. There's a lot of risks that we need to evaluate those contracts for so that we know that when all is said and done, we're not gonna find ourselves in a difficult situation. And because we don't really understand I find hospitals are kind of they're just signing these contracts. They can, "Oh, no, no, life's good." And they're not stepping back and asking how AI tool works and how it's managed and how the information is stored and how all this stuff is happening. So those are some of the other kinds of risks I think we need to identify upfront, and then we need to make sure that our implementation is strong.
And on our next podcast, we're going to expand on this a little bit and talk about how you can move from that bureaucratic compliance culture to that more generative, proactive culture. So we'll build on this a little bit more as well. Just to wrap this up. So thank you for spending the last hour with us. I hope that you found this conversation interesting. And if you did, please make sure to follow us on your favorite platform. In addition, to learn more about us, please go out to our website at qualitycalendar.com. And we hope that you join us on our next episode. Thank you.